The thermopane. The thermopane is the boundary layer of water around the extremity that is warmer than the cold bath due to energy transfer, which is the heat, from the skin to the water. The loss of this thermopane allows tissue to cool more rapidly. So in our case, that's why we put the jets on in a cold whirlpool, because it continuously breaks down that thermopane layer. Whereas if you're in an ice immersion, if you don't move your foot, you're going to have that thermopane layer. Advantages: circumferential cooling. Entire limb or joint is cooled. Greater surface area that is exposed to the cold equals a greater or a decrease in tissue temperature. At rest, skin temperature can remain below reapplication levels for over 1 hour following a 30-minute treatment of cold pack application. More rapid rewarming occurs when cooling is followed by physical activity. What the main reason for this is there's an increase in blood flow from the activity, which increases the tissue temperature. So this gives us an idea that if you ice someone 30 minutes before practice, then you need to make sure they're warming up before they go in. Same with cold tubs, anything like that. You need to make sure there's a rewarming period because it will decrease the muscle firing. Physiological responses to cold. Blood flow. Localized cooling lowers the metabolic activity and oxygen demands on the cell. When oxygen demands are decreased, there's less overall tissue damage because more cells survive the period of hypoxia, or lack of oxygen, following injury that is caused by the disruption of capillaries and congestion from edema. Vasoconstriction and decreased local blood occurred to superficial and deep tissues. Superficial vasoconstriction occurs primarily through reflex mechanisms, whereas decreased metabolic activity is responsible for decreased blood flow to the deep tissue. Muscle spasm and function. There's an attempt to break the pain spasm cycle. Decrease in pain is going to decrease spasm. There's a reflex contraction following injury. Muscle spindles feel a stretch of the muscle and respond by contracting. This is used to splint the area and prevent further injury. So you're trying to contract that area and constrict all the damage to one area. Spasm occludes the blood flow and exacerbates the pain spasm cycle. So with spasm, you're going to have pain. Cold decreases the spasm through direct and reflex mechanisms. When cooled muscle spindles are less sensitive, then muscles relax and the spasm is relieved. Decreases in muscle spasm begin to occur before the muscle is completely cooled, suggesting a reflex response to cold as well. Force production of muscle decreases as well. So again, athletes should always warm up before returning to activity following cold application. Nervous system. There's a progression of sensations, and we call it C-band. So you're going to feel cold for 0 to 3 minutes, burning for anywhere from 2 to 7 minutes, aching from 5 to 10 minutes, and the ultimate goal is pain reduction, and that's numbness, so 7 to 12 minutes. The importance of this indicates that initially cold and pain receptors are stimulated. Cooling of nerve fibers slows the conduction of neural impulses. After several minutes, sensation is diminished because neural impulses can't be transmitted from the periphery to the sensory cortex. Results in numbness or analgesia, which is pain relief, and that is our first goal of rehab and treatment. Indications for cold. Pain relief is number 1. Then we go to acute injuries, which are sprains, strains, any inflammation, and delayed onset muscle soreness, muscle spasm, muscle spindles, Golgi tendons or Golgi tendon organs, and nerve conduction velocity are decreased. Contusions, effusion, hematoma, hemarthrosis, burns, you just have to be careful, myofascial pain, and then as an adjunct to therapeutic exercise, and edema.